So BreastScreen WA is a free service for women over the age of 40, and we screen well women with no symptoms of breast cancer. So we're looking for breast cancer before you would notice by feeling or seeing any changes to your breasts. Having a breast mammogram or a breast X-ray can find breast cancer the size of a grain of rice. So before you could see or feel any changes. If we find breast cancer early, we can treat it successfully, and the woman who has breast cancer can go on to live a healthy, happy life after her diagnosis. It is one of the most common cancers that affect women. So once women turn 50 in Australia, if they're on the electoral roll, so if they're able to vote, when they turn 50, we send them a letter or an invitation to encourage them to make an appointment for a free mammogram. But from the age of 40, it's a free screening program. For most women, we say have a screening mammogram every 2 years. As you get older, your risk increases. And if you've ever had a breast cancer or an ovarian cancer, then your risk of getting breast cancer moving along in your life or as you get older increases. If you've got other women in your family that have had breast cancer, then you need to be more aware about being breast aware and getting tests done regularly to make sure that you're okay. Another risk factor is the misuse of alcohol. And alcohol has been linked to many different diseases for people, and it has been linked to breast cancer. Being overweight or obese in adulthood after menopause is also something that can increase risk. And there are many hormonal factors that can also increase your risk. The hormone estrogen has been linked to breast cancer. So the appointment takes 15 minutes, but if you need an interpreter, we just ask you to come to your appointment 15 minutes earlier and meet the interpreter, do your paperwork, but your appointment will still be 15 minutes. Once you've had a mammogram with us, when you come in, we'll ask you, do you want your results to be sent to your doctor? You will get your results in about 3 weeks, 2 to 3 weeks. So when you're coming for a mammogram, we ask that you wear a 2-piece outfit, so a top and pants, because you'll be removing the top garments so that we can do the mammogram. It's important to know that another woman will be touching your breast tissue to position it ready for taking the X-ray or the screening mammogram. So being breast aware is about getting to know what your breasts look and feel like at different times so that you can tell when there's changes happening. So looking and touching your breasts is a way to see if you feel or see any changes. And we recommend maybe once a month. If you're still having a menstrual cycle, do it after your menstrual cycle. So it's best to check after, when your breast tissue's settled down, if you're still having a menstrual period. And when you are checking, it's important that you check beyond just the actual breast. Often if there's something wrong with tissue in the body, the lymph nodes are a first indicator that there's something wrong. They'll get quite tender and uncomfortable, and you may notice a change in your lymph nodes before you notice change in the actual tissue. I think all women have different breasts. So for example, during puberty, when your breast tissue is developing, through your menstrual cycle, your breast tissue changes. During pregnancy and while you're feeding babies, your breasts change multiple times a day. And during menopause, your breast tissue also changes. So these are normal changes. So any abnormal lumps or lumpiness or thickening of the breast tissue Any change to the nipple. So any change to the size, the shape or the colour, if there's any discharge, and if your nipple becomes inverted. So inverted means that it's going in towards your body rather than sitting out. Some women have inverted nipples and that's normal for them. That's something that needs to be checked by your doctor and have some tests done to make sure that everything's okay. Any change to the nipple, but also to the skin of the breast. So any dimpling or puckering, any rashes or redness, or any new or unusual pain. So women tell us that they have breast pain and it can often be cyclic, so it will be in time with their menstrual period. So many women experience breast pain, and for those women that would be considered normal. But it's when you have never had any pain in your breast before and all of a sudden you'll get breast pain that you need to get followed up by your GP and go and talk to your GP about that.